Welcome to the Eat Better, Move Better, Live Better podcast presented by Flourish with Tracy, where we'll dive into the realms of holistic wellness, plant-based nutrition, yoga, and self-care to help you live your best life. Tune in every Monday, Wednesday, and Saturday at 8 a.m. Eastern for our special segments. Meditation Monday, start your week with mindfulness. Wellness Wednesdays, get the midweek boost you need. Sadhana Saturdays, dedicate weekends to personal growth. Join us as we explore and discuss all things to eat better, move better, and live better. Today, we're going to talk about our natural response to stress. It's anxiety. It's part of our survival instinct, and it's often referred to as fight or flight response. It helps us stay alert in dangerous situations. However, when anxiety becomes problematic or chronic or overwhelming, how do we handle this? So today we're going to talk about handling anxiety holistically. When anxiety becomes frequent, disproportionate, or persistent, it can negatively affect our health, relationships, and daily functioning. Symptoms include racing thoughts, tension, fatigue, restlessness, insomnia. Anxiety affects both the mind and body, leading to symptoms like overthinking, muscle tension, exhaustion, sleep disturbances, and inability to focus. So what are the symptoms and difference between feeling anxious, feeling a bit of anxiety, or normal fight or flight response, or a full-on anxiety attack? How do you distinguish it and when to get help? Well, there's a spectrum of anxiety, and this will help us understand and recognize what we're feeling, normalizing our experience, and knowing when to seek help. Let's break it down. So the spectrum goes from a normal anxiety, worry, to full panic attacks. Our normal stress response is just feeling anxious. It's a natural response to a stressful or uncertain situation. We may feel a little anxious before a test, a meeting, or some sort of shift or change. And common symptoms are mild restlessness, nervous energy, perhaps a slight tension in our chest or shoulders, or butterflies in our stomach. We may have worrying thoughts, questioning, what if, how come, what might. And we may have trouble focusing, feeling a bit on edge, but still able to function. Now, this type of normal anxiety is short-term, and it's usually tied to a specific event or trigger. So in this situation, holistically, you can take deep breaths. Just stop and count to 5. Breathing in and out. Perhaps you can close your eyes, or some sort of grounding exercise, taking a walk or talking with someone, reframing your thoughts, writing it out, positively affirming. This is healthy and expected, and the anxiousness will usually pass once the identified cause of the stress or the stressor is gone. And you tend to have a sigh of relief once you're past that point, and you return to your normal activities. Mild to moderate anxiety is anxiety that's a little more persistent or intense. It's not debilitating. It may interfere with your sleep, focus, or well-being. And symptoms of these could be racing thoughts, tension, headaches, muscle tightness, faster heartbeat, shallow breathing. Perhaps there's trouble sleeping. And there may be some behaviors that demonstrate avoidance, such as canceling plans or procrastinating. It may also lead to digestive discomfort or symptoms that mimic irritable bowel syndrome. It's a constant low-level worry, even without any clear reason, and this could last days or weeks, and it may come and go in cycles. Breath work also helps here, and reducing external stimulants such as caffeine. Therapy and support groups are also beneficial, as well as lifestyle changes, intentionally focusing on getting better sleep, setting boundaries, and exercise. The exertion will help release. But if anxiety becomes a default state, it's worth addressing, perhaps seeing a mental health professional or a therapist. And the furthest end of that spectrum is a full-on anxiety or panic attack. It's a sudden or an intense fear or wave of fear of discomfort. It may feel like something terrible is happening, even when there's no immediate danger. And this may manifest as chest pain or tightness, very rapid heartbeat, shortness of breath or hyperventilating, dizziness, lightheadedness, sweating or chills, numbness or tingling, especially in the hands or face, feeling detached from reality, and a sense of impending doom or losing control. And these peaks can last 5 to 10 minutes. However, they are usually resolved within 30 to 60 minutes. And what helps is the grounding techniques. Counting down 5, 4, 3, 2, 1. Focusing on what you see, hear, and actually feel. And as you're counting down, begin to slow down the breath, breathing rhythmically, beginning to reassure yourself, placing one hand on the heart and the belly as you breathe down. This is temporary, I am safe. Sitting somewhere quiet until this feeling passes. But know, if these attacks are recurring, get help. If they are interfering with your daily life, get help. If you fear having another one, anticipatory anxiety, get help. Seek professional support if you feel anxious more days than not for several weeks on. If the anxiety is disrupting your sleep, work, or relationships. If you avoid situations because of panic or fear. If you've had recurrent panic attacks. If you're using external substances, food, or other behaviors to numb the anxiety feelings. If you feel hopeless, overwhelmed, or physically ill from chronic worry. You don't have to wait until it's that bad. You don't have to wait until it's that intense. You don't have to wait until you've had more than one. One is enough to get help. Seeking the assistance of therapy, coaching, a holistic health support can be incredibly effective early on. The earlier you begin, the sooner you can work towards your healing. And often this will help you prevent even more serious patterns of anxiety forming. Holistically, you can continue to, with the help of a professional, look at the mind, body, and spirit. And if you are just experiencing mild anxiety, these techniques will also work, focusing on the mind, body, and spirit. Mental health includes how we think, feel, and process information. Our thoughts, emotions, and cognitive patterns can be distorted, and we may make it a catastrophe or overgeneralize it to feed the anxiety. Recognizing this will help us address it. Our body, which is our physical health, our nutrition, our movement, and our sleep, will significantly influence our mental health. Poor sleep, lack of exercise, and nutritional deficiencies changes the chemical makeup within our body and can increase anxiety. And when we feel disconnected from our purpose or lack spiritual nourishment, anxiety can intensify. Spiritual health fosters inner calm and resilience. And spirituality here is not the same as whatever your religious beliefs may be. In this context, spirituality means your personal values, what they mean to you, your connection with your inner peace. To address anxiety, let's look at the mind, body, and spirit in a little more detail and holistically. To support the mind, you can begin with cognitive behavior techniques called CBT. It helps identify and challenge irrational thoughts. For example, replacing "I can't handle this" with "I've handled tough things before." Mindfulness and meditation, by practicing present moment awareness, reduces reactivity to anxious thoughts. Regular meditation changes the chemicals within your body and lowers the stress hormone levels. You can write about it. Journaling about your fears or stressful events helps to process emotions and uncover patterns. You can try gratitude journaling or stream of consciousness writing. And what this means in gratitude journaling, just what are you grateful for today? Within the past minute, one thing, three things, or just grateful for the opportunity to journal. And stream of consciousness writing is just allowing your thoughts and feelings to just flow, free form, just writing just the way your mind is naturally thinking at that particular state and time, without any judgment, without any editing. Just let it flow. This style of writing allows you to release. And then also to support the mind, limiting stimulants such as caffeine or screen time. Caffeine can overstimulate the nervous system, mimicking anxiety symptoms. And excess screen time, especially at night, disrupts the sleep and increases rumination. To holistically support the body, nutrition is important. Omega-3s, magnesium, and whole foods are key. Foods rich in omega-3 fatty acids like flax seeds support brain health. Magnesium helps regulate the nervous system. And avoiding processed sugars and alcohol, consumption of whole foods, which is fruits and veggies. Exercise, daily movement, yoga, tai chi, or just working out. Physical activity boosts mood regulating neurotransmitters like serotonin, and gentle practices help promote relaxation and balance. And we've said it several times before already today, sleep. Establishing a constant routine and a good sleep hygiene. Quality sleep is critical. It's when all of the body works to restore and balance and heal. When we use wind down rituals, avoiding screens before bedtime, and maintaining a consistent sleep-wake schedule even on weekends will help reduce bouts of anxiety. And in focusing on the breath work to activate the parasympathetic nervous system. Breathing techniques or breathing slow help calm the mind and slow down the heart rate. Breath awareness connects you back to the body and the present moment. And we can holistically support the spirit through meditation or prayer. A daily spiritual contemplative practice nurtures your inner peace and acceptance. And as mentioned, it doesn't have to be religious. Your spirituality can be about reflection or gratitude. You can also spend time in nature. Nature restores the nervous system. Being in green spaces reduces cortisol, blood pressure, and mental fatigue. Creative expression, art, music, dance, or writing can unlock emotional blockages and channel anxiety into something meaningful. And connection is important spiritually, friends, community, and therapy. Isolation increases anxiety. Supportive relationships and meaningful conversations are deeply healing. You can even do group therapy or peer support. They are also very helpful. And then finally, reflecting on purpose and meaning. Live your life in alignment with your values. This will foster a deeper sense of peace. You can ask yourself, what matters most to me? Or what kind of life do I want to live? And then you can take all three and create lifestyle practices. For example, yoga for the body and the breath and presence to integrate the movement, control the breathing, and exhibit mindfulness. Physically, it releases tensions while calming the mind and connecting to the spirit. The grounding movement piece, such as a walk in nature, will improve the mood. It helps to ground and release the anxious energy, and it offers a quiet reflection. Walking barefoot on natural surfaces, which is earthing, also helps improve regulation. Sound healing or music therapy. Vibrational therapies like singing bowls or calming music, embracing frequencies activate the parasympathetic system, the part of our nervous system that calms us down, and it reduces anxiety. Music is also an outlet if you wish to create music and play music to express yourself emotionally. And then detox digitally. Reset your mind and body by taking breaks from screens to reduce overstimulation. This improves the sleep and reconnects you with your body and your environment. Now, if you've tried these things or you're noticing that it may be a little more serious on the anxiety spectrum, here are some things to look out for to know when you should seek help. And it is okay to seek help. If you have persistent anxiety and it's interfering with your life, affecting your work, school, relationships, and your everyday functioning, professional support is essential. If you have sudden episodes of intense fear, racing heart, dizziness, breathlessness, it may be a panic attack or disorder, which may need clinical attention. If there is some unresolved trauma can lie beneath chronic anxiety. And there are therapies, somatic experiences, or trauma-informed yoga to support healing. And there is also EMDR therapy. EMDR stands for eye movement desensitization and reprocessing. It's a psychotherapy technique designed to help heal from trauma or other distressing life experiences and conditions like PTSD. This therapy should be received under the guidance of an EMDR certified mental health professional or therapist. And there are other professionals as well: integrative therapists, naturopath, or functional medicine doctors. These are professionals who address root causes, including gut health, hormone imbalance, and emotional stress. And there's sometimes the need to use medication for anxiety. Medication can be given It's typically most effective when it's combined with therapy, lifestyle changes, and self-care. And this should be when the anxiety is severe or debilitating. Medication is not the first suggestion if you are suffering from mild anxiety. However, under the guidance of a mental health professional, functional medicine doctor, naturopath, or therapist, medications may be administered where necessary. And they fall into different categories. There are medications that work to increase serotonin levels, medications to enhance the effects of the calming neurotransmitters to produce a sedative effect. There are medications to support the serotonin receptors. There are medications to block the adrenaline receptors, reducing symptoms like palpitations or sweating. And in some cases, even an antihistamine can be occasionally prescribed for short-term anxiety relief. It's important to work with your mental health professional because, as with any medication, there's always risk and side effects, and there is a time factor for the medication to actually work within your system. Working with the medications in combination with the holistic view of breath work, nutrition, movement, therapy, and spiritual connection can help to stabilize as needed. And then accompanied with therapy and self-care and lifestyle changes is also key. What's important is to make sure that you're not self-diagnosing or medicating. Mild anxiety is normal. That is our natural stress response to a situation. It is temporary and it goes away. If, however, as mentioned previously, it doesn't go away or it continues to reoccur, seek help. It's important to learn about anxiety and holistic health. It's also important to know when to seek the guidance, as we've mentioned before. Self-diagnosis can be harmful, as anxiety shares symptoms with other medical conditions, thyroid, heart, and nutrition deficiencies. And without a trained assessment, you may misunderstand your symptoms or miss underlying causes like trauma, hormone imbalance, or chronic illness. Don't assume your condition and don't self-medicate. You want to avoid misusing prescription medications, supplements, or natural remedies because they may be inappropriate for what's actually happening. Be sure to be proactive about your health, but also be sure that your path and your information is safe and supported by trusted guidance. Always consult a qualified medical and mental health professional, practitioner, or therapist for an evaluation. And for holistic herbal supplements and herbs, seek guidance of a naturopath, herbalist, functional, or integrative doctor to make sure that your treatment is safe. And then you can combine all of this information with the holistic practices. We mentioned earlier about proper nutrition and how it may impact our anxiety. But there are foods that help regulate our mood, balance our blood sugars, and reduce inflammation. And they support healthy production of our neurotransmitters within our body and our brain. Brain boosting nutrients are omega-3 rich foods, as we mentioned earlier, such as chia seeds, flax seeds, and walnuts. We mentioned magnesium rich foods, which helps to calm our muscles. These would be dark green leafy vegetables such as spinach or kale, pumpkin seeds, avocados, and almonds. 70% or greater in dark chocolate in moderation, and this chocolate should be sugar-free. Vitamin B complex foods are great for mood regulation, such as beans, whole grains, bananas, and foods which contain tryptophan, such as sesame seeds, and fermented foods which help balance the gut and brain. Tofu, kimchi, sauerkraut, yogurts with live cultures, miso, tempeh, and reduce the caffeine and replace with caffeine-free herbal teas. Healing is not linear, and it's not just in the mind. It lives in how we breathe, eat, move, and connect. It's not about quick fixes or perfection. It's about consistency, compassion, and honoring the whole self. True wellness comes from integration of the mind, body, spirit, working together to create a more peaceful you. So if you'd like to reduce anxiety by activating the parasympathetic nervous system, which is our rest and digest mode, just begin with rhythmic, mindful breathing. Here's a short exercise. So you can begin by getting comfortable sitting upright with your feet on the ground. You can lie down if you prefer. You can allow the hands to rest gently on your lap or on your sides and soften the gaze or gently close your eyes and just be present. Softening your tongue, unclenching the jaw, allowing your body to be supported by the surface beneath you. And just breathe in. And as you do so, count to 5. Holding the breath. And then slowly exhale. And you can repeat this cycle, breathing in, counting to 5, holding, slowly exhale. And you can repeat this process as many times as you need, breathing in 1 time, breathing in 4 or 5 times. How many times you choose is your choice. Now, after your last exhale, return to your natural breath and feel the air flowing in and out, and notice how your body feels. Is there a little more softness, a little more space? And you can wiggle your fingers and toes and open your eyes. Just take a moment of gratitude just for those couple of seconds, just for showing up, for breathing and being here. And anytime you feel anxious, you can exhibit this practice. Just breathing in, counting to 5, holding briefly, and releasing. Just breathe. And as you reflect, remember that anxiety is not a flaw. It's a signal. It's a message from the body, the mind, or the spirit asking you for care, attention, and balance. Whether your anxiety shows up as a passing worry, a chronic hum, or a full-blown attack, you are not alone. You are not powerless. Whether it's breath work, better nutrition, herbal teas, therapy, medication, or meditation, all of these are many paths to healing. Holistically, we are reminded that true well-being comes from integrating all parts of ourselves, the physical, emotional, mental, and spiritual. Taking what's resonating, knowing it's okay to be curious, gentle, and honest with yourself. And if you're ever unsure, remember that asking for help is okay. It's not weakness, it's wisdom. So breathe, nourish, reflect, connect. You deserve peace, not just in moments, but as a way of life. Thanks for tuning in. I hope today's insights help you on a personal journey towards a healthier, happier life. Don't forget to join every Monday, Wednesday, and Saturday at 8 a.m. Eastern for more self-care and holistic wellness tips. Before you go, make sure to comment, click the bell, like, and subscribe buttons for upcoming episode notifications. Be sure to always consult a medical professional before making any major changes regarding your health, diet, or routine. In the meanwhile, stay motivated, stay inspired, and remember, every step you take is one step closer to a better you. Until next time, keep flourishing, and as always, may all be well.